Good afternoon, everybody. Thank you for joining us today. We're going to get started in just a couple seconds. We're going to wait another half a minute or so and let some other folks in, and then we'll get started. Thanks for joining us today. Okay, I am going to kick us off and we'll get going today. My name is Kristen Angel. I'm the Associate Director of Advocacy here at NORD. I oversee our Rare Action Network program, which is our grassroots-based advocacy network of fabulous volunteers such as Amy, who's our hostess with the mostest today. Thank you for joining. We are celebrating Rare Disease Day across the country this week, and on the official day, which is Sunday, February 28th. And we are having these events simultaneously throughout the week in about approximately 30 states. So we're really excited and we're really busy this week, but we're excited to have you all. I'm going to kick us off here with a quick disclaimer. Just to clarify, this will also be located in the chat as well, and you can feel free to use the chat function for questions. We will be taking questions at the end of the program. But we cannot provide medical or legal advice. Our organization does not staff medical professionals nor legal staff. So this is just a quick disclaimer. If you would like to read it, you can check it out in the chat momentarily. And I am going to switch my screen. Oops.
I am Tristan.
Angelina.
Nawazay Shafiq.
Regina.
Habari asubuhi Javi. Jag är Christian och jag bor i Norge.
I live in the United States of America.
In Australia.
Malaysia.
No Brasil. Tunaishi Kenya.
My passion is for fashion and design.
I love to dance.
Para viajar e descobrir novas kulturer. Anapenda kunitazama nikipuliza mapovu. Jag älskar idrott och spelar spel med familjen min.
Minhas paixões são minha fuga quando as coisas estão difíceis.
Ada hari-harinya apabila melakukan perkara yang biasa akan jadi sangat susah. When your disease makes you feel isolated.
It's difficult to walk.
Och vara med på laget.
When I'm tired.
Afraid.
O controle da doença pode ser desafiador.
Atau mengecewakan bila saya kehilangan masa.
Muda muhimu sana.
But we learned to be resilient.
Para apreciar os pequenos detalhes que me trazem alegria.
Kumuona mtoto wangu wa kiume anavyofurahi tunapoenda nje. Nikijua anasikiza hadithi na sauti zilizo karibu.
Mencari titik hubungan dengan masyarakat yang tak pernah saya sedar wujud.
Om övergivet på grund av mänskliga utfall.
There is support.
Sua bondade inabalável.
Yeah, big trailer.
Mina vänner,
Keluarga,
Enfermeiras.
Doctors.
support workers.
assistenter, mashirika ya wagonjwa.
Together, we are a strong community.
Nimeweza kuelekea
Histórias compartilhadas que me libertaram das dúvidas.
Vågar centeles.
I am Tristan. I live with sickle cell.
I'm Angelina.
And she has caused a neurological disorder. Saya Shafiq dan saya hidup dengan ectodermal dysplasia.
Regina, eu tinha leiomiosarcoma, um câncer raro.
Huyu ni Harvey, ana SMA, spinal muscular atrophy. Johan Christian och jag har unge med benskörhet.
Esta é minha vida.
Suara saya. And I am more than my disease.
We are rare.
Kami ramai.
Nós somos fortes.
And we are proud.
Great. And I have one more I'm going to share.
Welcome. I'm Peter Saltonstall, President and CEO of the National Organization for Rare Disorders, and would like to welcome you to our 2021 Virtual Rare Disease Day event. Before we begin, I would like to send out a special thank you to all those advocates and others who have spent so much energy and time supporting the rare disease community. So thank you. The role of Rare Disease Day is to bring together advocates and patients from around the world to help tell the story about rare diseases. There are events like this happening virtually all over this country today, and some of the audiences that we're really trying to focus on are those in the state legislatures, where advocates and legislative people come together to understand the burden of rare diseases and the impacts it can have on them, and therefore build the appropriate legislation and pathway to make sure that bills are passed that support rare disease patients. As a matter of fact, NORD's doing that in a very focused way with rare disease advisory councils. We've got them set up down in 16 states and are building them in others. I think 2021 is going to be an interesting year for us. The reason I say that is because we've just come off of a very difficult year with a pandemic that's impacted the rare disease community in a number of different ways and has really shown some of the inequities in the healthcare system. For all of you that are watching today, the importance of the rare disease advisory councils is critical to the success of being able to communicate the story and the needs of the rare disease patient community. So in conclusion, I would really like to make sure that I recognize and thank all of those sponsors who have helped us make this day a none of this would happen. So a sincere thank you from all of us at NORD and the patient community. Taking part in events like today's are really important to the rare disease community, and we must always remember that alone we are rare, and together we are strong.
Thank you guys for joining, and thank you for taking time to listen to that great, quick, short video welcome message. I'm Amy Guarneri, and I am the Nevada Rare Ambassador. I am a volunteer. I am a patient. I am a caregiver. My rare started with primary autoimmune deficiency, and it was a struggle finding what exactly was going on, as most of you know. I'm honored to be part of the NORD community. We are looking for help because Nevada is not just, we have Southern and Northern Nevada, and if we can get another co-ambassador to help me out with these great events, as well as new events coming up, we'd really greatly appreciate it. I want to thank Kristen and everybody who has helped make this event possible. If it wasn't for them, it's fantastic. And I also want to thank both Senator Lang, Senator Woodhouse, our patient and caregiver speakers, as well as the RDAC community and everyone else who's joining us, because like it was stated in the video, together we are strong. And it's so important to remind us that we're not alone in this. So with that, I would like to bring it back to Kristen to speak on behalf of the report card and RDAC.
Thank you, Amy. So I'm going to just do a brief overview of NORD's involvement with the Rare Disease Advisory Councils, which we're referencing as RDAC for short, for those of you that are not familiar. The problem that we've seen is there's 25 to 30 million Americans that are living with one of the 7,000 rare diseases. 1 in 10 Americans have a rare disease, and state policymakers often have limited awareness and knowledge of the impact that the rare diseases can have on patients, their caregivers, and the overall healthcare system. The solution is Rare Disease Advisory Councils, a diverse body representing the rare disease community to advise state government on their common obstacles. It's an opportunity for government officials and the rare disease community to come together and develop resources necessary to prevent and address barriers and obstacles in a strategic way. 16 states have enacted RDAC legislation. And as you can see in Nevada, there was one enacted in 2019, and you'll hear more about that throughout today with some updates from some of the folks on the council. And we are currently, the orange states that you see here are states that are currently working on proposed legislation within their states to get an RDAC passed in their state. And then the darker blue area is where there's not currently a Rare Disease Advisory Council or any proposed legislation or work being done towards proposed legislation. NORD launched Project RDAC in December of 2020 with a primary focus going into 2021 of a couple of areas of the project. NORD is going to act as kind of a connector to getting the various states connected, the various states that have rare disease advisory councils, and connecting them so that they can learn from one another, share ideas, and compare notes essentially as to what their RDACs are working on. It also is an opportunity to create educational resources and guide these RDACs as they become established in the states and help strengthen ones that are already in existence. We're developing webinars. We've already hosted quite a number of them. We have more coming down the line this year. Toolkits and one-pagers specifically revolving around the Project RDAC. The Rare Disease Advisory Council was formed under Senate Bill 315 in 2019, as I mentioned earlier. Some of the council's duties include increasing awareness of the burden caused by rare diseases in Nevada, identifying evidence-based strategies to prevent and control rare disease, developing a registry of rare disease diagnoses in Nevada to determine the genetic and environmental factors that contribute to such rare diseases, and compile an annual report that includes a summary of the council's activities and recommendations of the council for legislation or other policies. And I will pop the Nevada RDAC website into the chat momentarily. I'd also like to take an opportunity to share a project of NORD that we have been doing for quite a few years now. We publish annually a state policy report card for every state. And what this state report card focuses on are these issues you see here listed. It takes a deep dive into how the states work within these initiatives, and they've got a grading scale from A to F in certain areas. Medical nutrition, Medicaid financial eligibility, newborn screening, prescription drug cost sharing, protecting patients in state Medicaid programs, protecting patients in state regulated insurance, rare disease advisory councils, and step therapy. You can access the state policy report card for Nevada and all the other states through our website. And you can actually we have a quick video here to help show you how to navigate the website.
We have the landing page for the 6th edition of the NORD State Report Card. We've just got a little intro text up here. And then we have the 8 issues that we assessed in the 6th edition of the report right here. If you go over here, we have a drop-down bar where you can click and select your state. And then right underneath of that, we have all of these patient stories about some of the issues that are focused on in the report card. So now I'm just going to navigate to one of the issue pages. I'm going to click Medicaid financial eligibility, and that'll take you to this individual issue page. We just got a little bit of intro text again at the top, and then some more text about what the issue really is and why NORD cares about it. Underneath, then we have some text about the grading methodology for this section, as well as the rubric, which is available at the bottom, and also underneath of the map right here. Again, we have that drop-down bar where you can select your state. Then if you go to the left over here, you can click and access all of NORD's policy statements on the particular issue. And then you can also click and access the appendix for that section. So next, I'll look at the map a little bit. So you can hover over each state on the map and see the state's overall grade, which is bolded there for this section, as well as the subgrades that were averaged together to get that overall grade. If you click on any of the states, it will take you to that state's individual state report card page. So I clicked on Virginia, and here is Virginia's state report card. If you scroll, you can see that we have all 8 sections and their overall grade up here in orange, and then the subgrades underneath. And you can also click this right here if you want to open a printable version of the individual state report card.
So to clarify the methodology, this is actually a snapshot of all the issues that have been described from November 2020, with the exception of the RDAC. So those are actually through December 2020. Current legislation and any changes starting this year in 2021 are not reflected in the state's grades. Appendices include detailed data, and each topic contains the methodology section. If you have any questions regarding the state policy report card, we encourage you to contact our policy team at policy@rarediseases.org, and they'll be happy to connect you and discuss any questions you may have regarding the report card. Thank you. Amy?
Thank you, Kristen. And now we're going to switch over to Dr. Federizo. She is a nurse practitioner with the Hemostasis and Thrombosis Center of Nevada. And I will let you go ahead and take it from here.
Hi, as introduced, I am a family nurse practitioner. I have been practicing in the state for 10 years, and I'm going to speak on two different perspectives. I currently chair the Rare Disease Advisory Council for the state of Nevada. We were originally supposed to be combined and have our efforts in March of last year, but due to COVID-19, we had a delayed start into November of 2020. So we just began meeting in November of 2020, and we have had since 3 meetings. We have developed a subcommittee which looks at monitoring and surveilling current bill drafts that are currently up and available. One in particular that we are looking is one from the Patient Protection Commission, which is Senate Bill 40. A lot of the barriers we have found to fulfilling the objectives for the state include that there is not, there's no money available to fund the Rare Disease Advisory Council. And we have found that developing a registry and really getting the data out to the state is difficult even within our own institutions. So we are definitely working towards combining efforts with anyone that we can to help make this a reality. In time, we hope that this can become more of a registration where we can get this data, but currently we are struggling on a couple different fronts of different methods to be able to do that. Additionally, we are doing some development in regards to awareness. So we are talking about developing some key educational pieces for both the State Board of Medical Examiners and the State Board of Nursing to help identify rare disease earlier. As many people know, I'm infamous for talking about women with bleeding disorders because it takes 16 years to diagnose them, which is an unacceptably high time frame. So we are working very diligently to reduce those things as the RDAC. We are just brand new. So if you do have questions, definitely feel free to reach out to me. And I will transition into my role as the nurse practitioner and director of research at the Hemostasis and Thrombosis Center of Nevada. As I said before, I've been practicing for 10 years, and fortunately, due to the efforts of Senator Woodhouse in 2013, because of those efforts she did around nurse practitioner autonomy, Nevada did not lose access to its rural Nevada community. As a nurse practitioner, I have not been able to find a physician that's trained in hemostasis and thrombosis to travel to rural Nevada with me. So as a result of her efforts, rare disease in Northern Nevada has been maintained, including due to the tribal reservations. Unfortunately, recently AB3 passed, and within that bill, there was a one-line statement that said that there would be a specialty pharmacy program creation, and Medicaid's interpretation of that has now been to reduce our pharmacy reimbursement, although we do provide medical services as well. We have tried to convey the impact of that, and unfortunately, that hasn't really fallen anywhere. This problem is quite extensive because if we do lose that funding, unfortunately, even though I am the only adult provider that can go out to Oahe, Nevada, we will lose access to the tribes because we don't make enough in Medicaid reimbursement, which was also cut 6%, which we could have managed, but now with the pharmacy and Medicaid cuts, we may actually lose access to the Indian population. We've been told that there is non-emergency transportation, but we have not been successful in setting that up for our Indian tribe who, if anyone's unfamiliar with Oahe, Nevada, it's at the Nevada-Idaho border. So for Medicaid to transport those patients, it will be upwards of $500 per patient and a 16-hour round trip transportation versus what we were able to do is go out to them directly and provide those outreach services. So these are huge impacts on the rare disease community. And unfortunately, I think this may end up regressing access to care for rural Nevada. We had tried to offer a different plan that would actually save the state money, and that was not integrated either. So we're looking at different ways in terms of trying to preserve our rural Nevada access to rare disease. And we will continue to try to explain that tribes don't have Amtrak, they don't have Greyhound buses, they don't have cabs, they don't have Uber, and they sit 8 hours drive from me currently. So it's a 1,000-mile trip. So we are continuing to look at how we can continue to provide that service, but these are some of the rare disease issues that we've been facing that are now worsened, unfortunately, by some policies that are in place. And we enjoy the opportunity to work with NORD and get these messages out and work with them on getting the awareness in Nevada to get us to where we need to be. And I thank you guys for really appreciate having us here today. Thank you guys.
Thank you. I apologize
Thank you.
for stopping and starting the screen again. I was having some tech issues, but I think we're good now.
Thank you, Dr. Federizo, and thank you again for joining us for the second year in a row. I am now going to be introducing Senator Roberta Lang, which is part of District 7, and I have had the honor of speaking to her personally, and I think you guys will really enjoy listening to hear what she has to say. Thank you again, Senator.
Thank you, and thank you for having me today, and it's great to see my colleague, Senator Woodhouse, on this Zoom as well. I want to tell you share my story with you today. When I became 60 years old, I decided that I wanted to make sure that I had a strong senior life, and I went to a wellness doctor. I was making sure I was eating the right things and becoming healthy. I lost 40 pounds. Everything was great until my blood pressure went crazy. I went to my doctor, who fortunately his wife was a kidney doctor. He ran some tests on me and told me that I had a rare disease that 1 in 1 million people have. And it's where my complement system builds up too much protein, which my kidneys cannot disperse. I was shocked. I felt like my life was falling apart. He sent me to a nephrologist in town, one of the best, and I thought for sure that this was something that I would get over, only to find out that it would be with me the rest of my life. Not only that, in Nevada, we don't have a lot of doctors that can treat rare diseases. And for my disease, it is so rare that I have not found yet one person in Nevada that has it. And he said, I am so sorry. I want to treat you. I'll be your doctor in the interim, but you're going to have to leave our state to get care. And he said, I have done a lot of research and I found 2 doctors that you can go to in the United States. One of them is in New York, and one of them is at Mayo Clinic in Rochester. And so I decided to go to Rochester, and my doctor there is amazing. He treats people with my disease. And I entered the research project because for my disease, they don't know how I get it, how people get it, nor is there a cure for it. So they have a cocktail of medicine that we take. It keeps us stable, and I'm happy to report today, after 3 years, I am stable. And if you were to come to the Capitol and see my picture that I took before the legislature, you'd see a big round face because I was on steroids. Today, I'm much different and I feel really well, but my disease will never go away. I'll always have to take medicine, and I'll always have to travel to see my doctor. My life is the same as it always was. I'm a little more tired than I used to be. The medicine is so strong, it attacks my red blood cells, and I have to get injections because I have become anemic. And but in my role, I was elected senator in November, and it's has given me a platform where I can talk about my disease and talk about rare diseases that other people have. And I most recently spoke with the new head of the medical school for UNLV, Dr. Khan. And I think it's really important. I asked him, I said, what is the medical school going to do to help us with rare diseases in Nevada? What can we do? I'm here to help you. And he said that's one of the areas where they don't have anything yet. And so I look forward to the end of this session where I can meet with him and I can talk to him about rare diseases in Nevada and talk about how, you know, we can at our medical school create an avenue where people can go to doctors in Nevada and not have to spend thousands of dollars traveling to get the care they need. And in my case, you know, it even goes to the insurance companies. I had platinum insurance with Sierra Health. It did not cover Mayo Clinic. Unfortunately, I had an employer who cared about me a lot, changed our company insurance to make sure Mayo Clinic was covered. But still, it costs lots and lots of money. And it's a lot of money that people can't afford after all the prescriptions they have to take. So my goal moving forward is to work to make sure people know about rare diseases, and that's why I'm here today. I think we have stories to tell. It's so often we feel so alone, and I was fortunate to find a Facebook group of people that have the same disease I have from all over the world. And so when something happens and I'm not sure why it's happening, I can post on there and other people who've had the same thing will get back. But it is a very alone feeling, and I look forward to bringing rare diseases to the forefront because, as you said, so many people have them, and we have to tell our stories. So thank you so much for having me today. And if I jump off, I have education committee at 1 o'clock, so please don't think I'm not interested, but I have to jump off of my committee. So thank you so much.
Oh, Senator Lang, thank you so much. I think that touched a lot of us on your story, knowing that having somebody in the Senate to help fight for us and knows it from a personal experience, we really appreciate it.
Thank you.
So thank you again. Now next we have Senator Joyce Woodhouse of District 5. And I am so proud that she helped with Senate Bill 315, thank you, in 2019. And she is here to speak more on that. And thank you both for being.
Thank you very much. Good afternoon, and thank you for inviting me to join you today. As Amy said, I am Joyce Woodhouse, and I am a former state senator from Clark County, Nevada. And I was term limited back in November 2020 after 12 years of service, but I am so happy to see my best friend and colleague, Senator Lang, here in Carson City as a senator for the state of Nevada, so I can pass the torch to her because I was worried about this. But I wanted to share the story about why I got involved in this. I'm here today because a couple of years ago, I had the great opportunity of getting to know a wonderful, loving family, a family who had the terrible experience of learning that their son had cancer and losing him at an all too young age. Carson was 6.5 years old when his parents took him to the family pediatrician for what they thought was strep throat. His parents described him as a shining light with a heart of gold. He was outgoing, funny, smart, kind, artistic, fearless, and happy. He was obsessed with dinosaurs and knew the name of every one of them by the time he was 3 years old. He loved his stuffed tigers, dancing, drawing, baseball, motorcycles, and of course, monster trucks. He had a zest for life that was contagious and refreshing. So what happened after 2 courses of antibiotics that did seem to help with a strep throat was followed by numerous blood draws and then the unimaginable news that Carson had a rare and aggressive form of childhood leukemia. And just 2 weeks after his initial pediatrician visit, Carson quietly passed on. And that's when the parents and the grandparents contacted me. So while pediatric cancer is by definition a rare disease, more than 15,000 cases are diagnosed annually in the United States. This means that 1 in 408 children will be diagnosed with cancer before they are 15 years of age, and 1 in 285 will be diagnosed before they turn 20. These children and their families suddenly face some of the most devastating news, often without warning. So in 2019, when I heard the story of the Carson and his family, I sponsored a bill that was passed by the Nevada State Legislature, as you know, to enhance rare disease awareness and education among families, healthcare providers, and the general public to give children the best chance possible of an early diagnosis. Senate Bill 315 aimed to address childhood cancer in 4 ways. It did create the Rare Disease Advisory Council within the state's Department of Health and Human Services. It increased public education about the importance of annual physical examinations for children, because we do have so many children who aren't getting to the doctors when they need to. It also required the Department of Motor Vehicles to issue special license plates to increase awareness of childhood cancer, and aimed to help healthcare providers to better diagnose childhood cancer by requiring license boards to disseminate information concerning the signs of pediatric cancer, and to encourage licensees to receive training and education in the diagnoses of rare diseases as part of their continuing medical education. So a little bit about the Rare Disease Advisory Council here in Nevada and some of their recent achievements. They are responsible for examining the incidence, causes, and economic burden of rare disease in our state, increasing awareness among the general public and healthcare providers, identifying strategies to prevent and control rare diseases, studying the effects of early treatment as well as delayed or inappropriate treatment, establish a comprehensive plan for rare disease management, and developing a registry of rare diseases diagnosed in our state, among other things. It is comprised of healthcare professionals, individuals and their families, and organizations that have experience with or knowledge of rare diseases. Due to the COVID-19 pandemic and other factors, as you can imagine, the council did not begin their meetings until November of 2020. But between that time and January 2021, they have met 3 times, conducting primarily organizational meetings. The council has narrowed its initial focus to childhood cancer, newborn screening conditions, and factor deficiencies and inherited plate disorders. It created a mission and a vision and has established 2 subcommittees. One that focuses on legislation and tracking policy proposals in the 2021 legislative session, and the other one to work on a website and educational efforts. In addition, the council received informational presentations from representatives of the National Organization for Rare Disorders in 2 occasions regarding Rare Disease Day and what other councils are doing across the country. This is so important, that the work that you are all doing, and our council wants to be a part of that by providing an opportunity to bring together disparate groups, organizations, individuals, and families in pursuit of policy changes that improve access to care and timely treatment for individuals with a rare disease. It is my hope that all of us working together as a single entity that represents the broader community, we will be able to create a stronger voice for the rare disease community and those that advocate on their behalf. And also to help voices like those of Carson's parents and grandparents to be heard and to make a lasting change. So I thank you for inviting me to join you here today, and so appreciate the time and look forward to all of the work that Nevada's Council and the National Council will be doing on rare diseases and how we can address the needs of our children all the way through our seniors who have rare diseases that we're trying to find ways to solve and to assist them so that they are not alone. So again, thank you.
Thank you so much, Senator Woodhouse. I really, truly, truly appreciate all your work you have done for the rare disease. It is great having both of you here for all of us in this community and sharing how it's affected you guys both personally. And it brings a real, hopefully for everyone to know that we're not alone and we have people fighting for us. So thank you. Next, we have Nick Abdul Rashad. She is a pediatric hematologist, medical director, and I will let her take it from here. Nick?
Hi. Can you see me, hear me? Okay.
Yes, now we can.
All right. Well, I didn't expect to speak so soon. I was thinking I was going to listen to more. Okay, well, thank you. Thank you for this opportunity to speak today. I'm also committee member of the Rare Disease Advisory Council for Nevada. And I work very closely with Dr. Federizo at the Hemostasis and Thrombosis Center, Nevada. But I also wear a different hat in that I run the Sickle Cell Center in the clinic. I was going to just talk a little bit about sickle cell disease because it is a rare disease, to make everyone aware of what it is, what the challenges that we face here overall and also in the state, and what we've achieved so far in the state. So I have a couple of slides, so hopefully I can get through it within 5 minutes. So let me try and do this. Can I control this slide or you?
Sure, would you like, I can stop my screen if you'd like to share.
No, it's okay. If you can just go to the next slide, please.
Sure, just let me know when you'd like me to.
Okay, right now.
Advance.
Next slide. Let's see what you have. Okay, so just a brief introduction of what sickle cell anemia is. It's an inherited disorder. So our red cells are usually round and flexible and flows very easily through the through the blood vessels. But in people who live with sickle cell disease, the red cells can become this abnormal shape or sickle shape. And when it's in that shape, it clogs up the blood flow or clogs up the blood vessels. So then you don't get enough blood flow to certain organs, vessels, and different parts of the body. Okay, next slide. Next slide, okay. So as you can imagine, blood flows everywhere in the body. So when there's interruption of blood flow or vaso-occlusion, then you can get a multitude of complications, acute and chronic, anything from a stroke, pain when your muscles or bones or joints don't get enough blood, to just over time, organ damage from not getting enough oxygen to those different organs. Next slide, please. Again, it's an inherited disorder. It's rare in that we believe there's about 100,000 Americans affected with sickle cell disease. 1 in 365 African-American births are diagnosed with sickle cell disease. So it's predominantly in African-Americans. However, other ethnicity and race also are affected. 1 in 16,000 Hispanic Americans. And now globally, because of immigration, we see a lot of other different races. So it's hard to know exactly if someone does have it, except when we screen for it. About 1 in 13 African-Americans are born with sickle cell trait. In Nevada, we don't know the exact number, but based on the newborn screening data, we know that about 15 babies in the over 38,000 babies that are screened in the newborn screening program are diagnosed with sickle cell disease. In 2010 data, it was estimated we have about 500 to 600 people living with sickle cell disease here, but 2020 probably closer to 1,000. Next slide, please. The mortality of sickle cell disease that over time has improved significantly. The data has improved significantly. Back in children, we knew that they used to die from infection and sepsis, but with the start of newborn screening and being able to diagnose these babies earlier, we are able to start them on penicillin prophylaxis to prevent severe infection and sepsis. And as you can see here, back in 1979, when there was this curve, I don't know if you can see that first curve between ages 1 to 5, there was a bump, and we've been able to flatten that curve. And the life expectancy has definitely moved and increased in patients with sickle cell disease, but it's still significantly less than the general population. So if you can see the dark line, the life expectancy is around 40 years age. So definitely a lot less than the general population. Next slide, please. And when we look at sickle cell disease health disparity, it is significant. In terms of, this is data from CDC, in terms of health outcome disparity, the life expectancy I showed earlier is about 30 years shorter. There's a higher rate of readmission to the hospital within 30 days of being discharged. And the rate of stroke in adults ages 35 to 64 is 3 times higher in sickle cell disease compared to general population, and also in similar ethnic group, such as in African Americans. Then there's health resource disparity, where most patients with sickle cell disease are Medicaid beneficiaries, and 70% of doctors, or less than 70% of doctors in the US, accept new Medicaid patients. And then there are longer wait times to see a doctor. And because pain is one of the common and main complication for people living with sickle cell disease, where they otherwise appear normal, appear healthy, except when they are in crisis. So they sometimes are inaccurately perceived as drug seekers when they go to the ER, and then they get delayed in getting treatment. And then because it is a rare condition, even in subspecialists like hematology, the number of physicians that are trained and willing to treat patients with sickle cell disease are very limited. Next slide.
So you know, we're coming close to the time.
Okay, so just to say what we've done in Nevada, we actually got together all the community-based organizations. I see some are here today, and patient advocacy, myself, and with the leadership of Assemblywoman Medina Neal back in 2019, we got a bill passed, bill number 254. And one of the main ones that was to require the to start a registry and surveillance of patients with sickle cell disease, so we can understand and improve our care and find out what the disparities are in the state. Okay, next slide. And last year, we started the Sickle Cell Center of Nevada with a mission to improve health outcome in individuals with sickle cell disease, and also to improve the quality of coordinated and comprehensive services so that we can reduce morbidity and mortality caused by sickle cell disease. We're part of the Pacific Sickle Cell Regional Collaborative, which is the HRSA grant recipient. I'm also the hemoglobinopathy consultant for Nevada Newborn Screening Program, and I'm part of the Rare Disease Advisory Council. We have a lot of work to do, and we work closely with a lot of different community-based organizations, mainly Sickle Not Broken Foundation, Dream Sickle Kids Foundation, and Bridging the Gap Adult Sickle Cell Foundation. And that's my story. Okay, next slide. So this is where you can find me. I'm very passionate in helping people with sickle cell disease, as you may hear from other patients. And that's my time. Thank you.
Thank you so much. I appreciate it. And sorry to have cut you off. We could probably talk all day on sickle cell and everything you do and have done for the community. So I appreciate it. Next, we have Bridget Cole, Director of Programs and Services of Northern, that's supposed to say Nevada, that was a complete typo, of Children's Cancer Foundation.
Hello, everyone. So give me just a minute while I share our screen, and I do have Shirley here with us as well. So hold on real quick while I get our PowerPoints up.
Yes, and we also have Shirley Folkens Roberts, also with the Nevada Children's Cancer Center. We had you on both different slides, so sorry about that.
You're good. Yeah. While we're getting organized, this is Shirley Folkens Roberts, and I too am a member of the Rare Disease Council, and I'm a co-founder and the executive director of Northern Nevada Children's Cancer Foundation. And I wanted to thank Senator Lang for sharing her story and Senator Woodhouse for passing the bill. And I don't know if everyone can see.
She popped off, but yes, she had to pop off real quickly.
So this is
yes, please show your plate. Yes.
that was part of that bill, which is wonderful. I'm going to start off talking about the organization. We have a quick slideshow. We are celebrating 20 years. We are the Northern Nevada Children's Cancer Foundation. We serve families, and our mission is to ease the financial and the emotional burden of our families. And Bridget is our programs director and works directly with the families. And we, as was stated earlier, childhood cancer affects 1 in 285 children. And worldwide, every 3 minutes, a child is diagnosed with cancer. There are various types of cancer, many of you are familiar with most common leukemia, brain and spine. And we help kids to the border of Tonopah, right about Tonopah and all of northern Nevada, because there's a lot of services in southern Nevada. We help about 120 kids at any given time. And in northern Nevada, there are 40 new diagnoses per year. We also, in our 20 years, we've helped about 574 families. And one of the reasons we wanted to talk to you today is just to explain some of our services in the event that you run across people that may require our services. The most common referral method is through the doctors. The medical community is crucial as well. As this slide shows, we serve both in the Reno-Sparks area, the majority of our patients, but also the rural areas. And that is really important because it's very difficult for those folks to get to services. There's a lot more challenges and burdens, as Amber was talking about. We're trying to make it quick today, but Bridget's going to go through the types of services we provide.
Hello, everyone. So my name is Bridget. I'm the Director of Programs and Services here. So our services, we try and have very comprehensive, wide range of services, such as financial support. We have our eSmart program to help our kiddos that are needing to do distance learning, which unfortunately has become a very common theme for everyone, but it was very isolated for our childhood cancer survivors and immunosuppressed children. We also have our Inspire Scholarship and our emotional support. So I'm going to kind of dive into each of these categories and how we provide that assistance. And I just want to make sure that everyone can hear me okay. Yes? Okay, perfect. Yes. Perfect. So our financial assistance fund, this is the majority of what we do. As you can imagine, when a family is first diagnosed with cancer, their entire world has been flipped upside down. So our goal is really to help reduce that burden and provide that financial assistance. So for eligibility, obviously they have to have childhood cancer. We serve between the ages of 0 up to the age of 26. And they currently have to live in northern Nevada. So our service area is Tonopah North. So, as that slide previously that Shirley talked about, we serve a large population in our rural Nevada community. So what type of financial assistance is available? We can help with medical bills, transportation costs, meals while traveling, housing, and loss of income. And that's really just the surface of what we do, because we can really do so much more. And, we really try and assess each family's needs and provide them that assistance based on their needs. So we have provided more than $5.3 million in financial assistance to families in the last 20 years. So our eSmart program, once again, this was something that wasn't as common as it is now. Everyone's doing distance learning, but so many of our kids, because of their immunosuppressed systems, were not able to continue going to school. So we help provide laptops, tutoring services, anything really that they need to still remain successful and have that autonomy while they're going through their cancer treatment. So the eSmart is education, scholastic materials, academic resources, and technology. Then we have our Inspire Scholarship. So we have awarded over $500,000 in scholarships. And these are for our young adolescents, adults that are either actively going through childhood cancer and or are childhood cancer survivors. We give them scholarships for college, university, technical schools, trade schools, whatever their dreams are, we want to help them make their dreams come true. And then we have our emotional support. So we do family events, we have a toy cabinet, and then we do our No More Treatment celebrations. And I want to show you a quick little video of these bell ringings, and it's very powerful and wonderful to watch.
Well, that wakes us all up. So as Bridget noted, our mission really is to ease the financial and emotional burden, but finding a cure and improving treatment has always been so important to us. So we do a little piece of that as well. We hold our St. Baldrick's event, which I'm sure you're all familiar with, in Northern and Southern Nevada. And we've done that for 15 years. And in our community, we've raised $3 million for cancer research. One of the reasons I get so excited about that license plate is increased awareness of childhood cancer is really so important to improving funding and research. And we have seen results and we have seen improvement, and survivorship has increased from 58% to 84% since 1970. And in the last 20 years, it's increased by 5%. So in the time that we've been in existence, we're actually seeing improvements in survivorship. And of course, there's just not enough priority and funding for childhood cancer. Only 4% of the National Cancer Institute budget is dedicated to our children's cancer battles. So we do make an effort every year to make our presence known in Washington, D.C., as well as at the state level. Just quickly about our funding, we are not government or federally funded at all. We are privately funded. 78% of, or 78 cents of every dollar goes directly to our families. And we have a variety of fundraisers that we can scan through, because I'm trying to consider time. We are funded by foundations, individuals, corporations, and COVID has impacted our funding greatly. And of course, it's impacted our ability to reach our kids. And this is a slide of Kelly and Bridget and Bridget's little boy visiting with one of our kids on the bottom during some of our virtual and pivoting events that we've been trying to do. We've been trying to do drive-through events and that sort of thing, because now we all know, what our rare disease and our childhood cancer population goes through with isolation, and we're trying to make that happen for them. So thank you so much for having us and letting us talk a little bit about what we do. Please call us, or if there's anything we can ever do to assist a patient or family. And I will leave it there unless you have anything to add, Bridget.
No, I think that's it. Thank you so much for having us. And I'm going to stop.
Thank you both. Appreciate it. And I just want to let everybody know that this is being recorded. And if you missed anything or want further information, you will get a link and have the ability to contact me, and I can share people's information. So I know everybody's feeling rushed because there's so much information and we have great presenters. And now we're going to move into patients and caregivers and sharing their story. Robin, if you're ready.
Hi, everyone. My name is Robin Racer-Fetter, and I am both a patient, but my primary role is that of a caregiver. My daughter, who's in the picture in stripes, has a rare condition called Ehlers-Danlos, classical-like type. She is one in about 70,000 that suffers with this rare condition. And basically, Ehlers-Danlos affects all of the collagen in your body. And not to get too technical, but collagen is in every organ and every major system. So she'll reach for a bottle of water and instantly dislocate her shoulder, her elbow, her wrist, and all of her fingers all at the same time. So that's how it affects her joints, but it also affects her vascular system, her blood flow, her vascular system, again, made of collagen, doesn't squeeze tight enough to get the blood up to her head. Collagen also lines your digestive tract and your urinary tract. And with my daughter, she was a 5-sport athlete and a very good one at that, until one day when she dislocated her shoulder playing softball. And it took us about 5 years to get a diagnosis. And sadly, when Amy asked me to send in my bio, one of the things I said was self-proclaimed medical researcher, because her condition is rare. Most of the doctors, I've had doctors say, wow, that was mentioned briefly in med school, but I have no idea what it is. So instead of being able to see doctors in Nevada, we have traveled, we have doctors in 7 different states, back east, West Coast, Rochester, Arizona, CHOP, Cincinnati. And now that she has turned 18, we're running into the issue where adult doctors won't see her because she's only 18. Pediatric doctors won't see her because she is 18. And this has been an ongoing battle. And in talking to others in the Ehlers-Danlos community through Facebook, we're not the only ones. Medicine in Nevada is not good. And medicine in Nevada, they really believe if you hear hoofbeats, it is a horse. They refuse to look at things as being zebras. And things have to change. My daughter's she's in college, but is also currently bedbound right now because of a failed procedure that we had hope might work, but it didn't. But the medicine in Nevada is not conducive to patients, and especially young patients. When she was, I think, 16, she was having so much pain, because imagine dislocating constantly. Her hips, knees, ankles, everything goes out. And she was told that, sorry, you can't see a pain medicine specialist. You're only 16. So they put an age limit on when somebody is allowed to have pain. And again, in my Ehlers-Danlos groups, and I'm part of several, my child is not the only one that has these issues and has the treatment. And some doctors are, they're just rude. Whenever we go to an appointment, and she always prefers that I accompany her, because I have 2 binders. One is her current medical records, and the other binder is organized by type of provider, which at one point in time, she had 27 different specialists. And I am constantly searching and reading and have subscribed to like all of the major medical journals, so I can bring doctors the information that they need to have in order to treat my daughter. A lot of
don't mean to interrupt, but we're running out of coming close to time.
Okay, a lot of doctors are really good with reading the the journals I bring, but a lot of them don't want to be bothered. They went to med school, they know it all. My daughter has lived with it, but she doesn't know it all, type of thing. So I feel for others, that have these conditions, and I really thank our legislators for being involved and being here to listen today. And I thank everyone for speaking. Thank you.
Thank you, Robin. I'm so sorry to cut you off. I know we've talked for lengths on these issues that we struggle here in Nevada, and I'm sure that most of these people here are happy to hear, not happy, but know that they're not alone.
Yes.
So next slide, Kristen. Next, we have Kimberly Palma Ortega, who is also a patient with 2Q37-1 deletion, 11P deletion syndrome. And I do apologize, but we have 3 minutes for her to speak, and I'll be having to speed it up since we only have 30 minutes left and want to make sure we get to everybody.
Good afternoon, everyone. I'll go fairly quick. I've mentioned about the kiddos quite a bit, so I have this down to a T almost. And sitting on a handful of different councils and commissions and boards, I've had the opportunity through the state to kind of share their story. I've actually had the blessing in having some of the physicians that are on this call actually attend to my kids. Jonathan and Karina are extremely rare in the sense that they're born in the same family with the same two parents, but do not have the same genetic syndromes. Karina is just shy of 21. She is the one that is with the 20Q or 2Q37-1 deletion syndrome. With her syndrome too, there's some rarities that she has that are not even documented within her syndrome. Unfortunately, with the funding issues that we've had over the last number of years, they've stopped doing research on her stuff. Whereas with Jonathan, he has the 11P deletion syndrome, and there is still current funding going on, and there's a larger group setting. So with Karina, with the 2Q37 deletion, she's 1 out of 100 in the world and the only one in the state. And Jonathan is 1 out of 500 in the world and the only one in the state. We actually had one family come from the Midwest that moved up north into Nevada. So now there's currently 2 with the Wagner syndrome. But along that, we are on the spectrum. We have blindness. We've dealt with childhood cancer. We have ortho issues, organ issues, kidney issues, just riffing off what the mom said last, the binders. I'm known for being the binder mom for everything and anything in between. And without that, I think we'd really be in trouble. Just a couple of days ago, we were stuck in the ER with my daughter. So she's got a cecostomy tube, not a bag. And so typically it's the G tube setup, but it's to the colon. And so when we took her in and they did the CAT scan, they were thinking that she had some abdominal obstruction and all these things going on. And really, she just needed her C tube replaced. So we were stuck in the ER with everybody from the top to the bottom, trying to figure out what she had placed and what the next step was. And she has a medical bag with all the supplies just in case something ever happened. And I had a bunch of nurses looking at me as when they changed her C-tube out, I went in there and handled it and addressed it, and they were just in shock and awe. So without that binder, we really wouldn't have the ability to get medical care the way that we would. That goes for law enforcement as well too. If we, run into having a meltdown, since my 2 are on the spectrum, people will look at them being, 21 and 15 and go, what's going on? And with that, at least with that binder, we can also refer back. I think there's a disconnect in that regard as well. And then the same thing, even with school. It's very difficult when you're working with the nurses as well, trying to explain to them what's going on, where they're at. We have over 21 specialists between the 2. We're not done with surgeries yet either, but because of all the stuff that we're currently doing and the things that you guys are doing for our state too, and legislators and the doctors and those that are really involved with rare disease world, because of that, I've been able to teach my kids how to advocate. So Jonathan actually advocated for his eye to be removed when he was 13 to alleviate the pressure from glaucoma. And because of that, he has kind of became the VIP on a number of levels. He advocates through the Nevada Disability Advocacy Law Center. I speak on that. He also helps me with the Nevada DD Council for Developmental Disabilities. So he goes back and talks about the things. They've also been a part of transportation. And I will just say that even with the mom right before me, that I think the transition phase for our kids is probably the most difficult, because you don't meet the requirements for one, and you're just shy of meeting the requirements for the other. And in that, you're trying to build new relationships that you've had over the years where that trust factor was, and now you're navigating services with somebody that's not familiar with what's going on. And with our kids being extremely rare, unless they have a great bedside manner, it's a bit of a struggle. But I really do appreciate everybody on this call and giving us the opportunity and sharing our story. I wish I was slightly prepared. If we didn't have the ER visit, I would have had some pictures and a few things to share with you guys, so you guys could see them and get to see some things that they're up to and doing. But again, I really appreciate you giving me this platform to speak, and however I can help in the future, feel free to reach out, and I'd be more than happy to assist.
Thank you so much. I really appreciate it. And I like how you tied in with Robin about the notebooks, the transitioning, something we really do need to look at between the 18 and going into an adulthood with doctors, and having a platform where we can all discuss that. Next, sorry to be rushing this, but we want to make sure everybody has a chance to speak. And next we have Pamela White, who will be speaking as a patient and caregiver.
Thank you. I'm speaking as a patient because I am a sickle cell survivor. I'm not a sickle cell, but a cancer survivor myself. And so, yes, I've heard a lot here today, and I tell you, I am just impressed with the mothers and the speakers that I've heard. I've had the opportunity to even be at Capitol Hill with Robin and Amy. If you remember, we went and talked to the senators together. So
yes,
I got to meet Robin's daughter, and I got to meet Amy's mother. So I'm glad to be here today. Amy asked me if I would come and speak as a caregiver. And everything that I've heard today pretty much summed up what I would have said to you. I just want to again introduce myself. My name is Pam White. I am a mother of 2 that have sickle cell. So I'm a caregiver for them. Even though they're not children, I will always be a caregiver for my children. I'm also a caregiver for my mother, who has glaucoma. So I know the woes and the cares of being a caregiver. My mother is 88 years old. And so I'm having to do a lot for her as far as that goes. But as far as being a caregiver, I just want to say that being a caregiver can be overwhelming. It can be tedious. It can be stressful. It can be a lot of things that I can come up with a lot of adjectives for it. But what I want to bring out is the fact that it can be rewarding. It can be assuring. When we're the ones that when our children or when our loved one can't go and get this glass of water, but we can go and get it for them. We can hand that cup to our loved ones. When we can do for them what they can't do for themselves. That's the part that I like about being a caregiver, being able to take care of my loved ones. And I don't want to take up, and you know, I'm a little shy at this. Everyone that knows me, Dr. Rashid, Dream Sickle, Gina, you all know that I'm really a little bit shy at this, but I do want you to know that we're not just dealing with the physical side of what our loved ones are going through as a caregiver, but we have to deal with the emotional side of it as well. We have to be able to keep them uplifted and joyful, and even through those trying times, the really bad times, we'll have the things that we can think of and bring back some type of memories of some type of fun times. So I say as a caregiver that we spend as much time as possible with our loved ones. We find a hobby together. I don't know if it's just sitting in the park or looking at the birds and the trees. Find something that we can come together and enjoy together, because we know that the times are hard, and even sometimes that they're not even wanting to be bothered with us. I think that we need to make sure that we have a village. we have some others that we can call on. You know, Amy's mom might not feel like being bothered with Amy for that day. Amy's mom should be able to call me and say, Pam, would you please come and sit with Amy so that I can get out and take care of myself for a little bit. As caregivers, we do need to find time for ourselves so that we can refuel and come back and take care of our loved ones. And so when I say a village, I'm not talking 10 or more, it could be 1 or 2. But what I like about this, the rare disease, is that in NORD, is that the village is right here. We have what we need right here. I'm glad for the politicians that were on, and here they're hearing about this, they're hearing about the struggles. I heard about the health disparities. I'm hearing the same thing in the sickle cell community as I'm hearing in your community. There are health disparities when it comes to the doctors not understanding what our children, what our loved ones are going through. So I'm thankful for the ones that are here. And I just want to say too, when you're with your loved ones, listen, let them have a chance to say how they're feeling. I take my mom and we just drive, and she gets to pour her heart out. She doesn't like not being able to see like she used to, and I let her pour her heart out, I let her cry, I cry, and then we go back and we think on things that we have shared together as a family throughout the years. And I'm asking too, that you let people know what you need. Don't feel shy, don't feel so proud, don't feel like you're ashamed, don't feel like your children don't want you to tell what they're going through. Let people know what you're going through and what you need so that we can be there for you. These are the things that I'm asking of a caregiver. And so I thank you for my time to come and share with you. And I'm grateful to be a part of this organization. Thank you.
Pam, you are not shy. I love hearing you speak. It was that you touched on so many important things that I think we miss out on. And thank you. I really, 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 truly appreciate it. You did a wonderful job.
Thank you.
I mean, phenomenal. Thank you so much. All of you speakers did. We are now moving into the healthcare provider industry. Shelley Nickerson of Optum Frontier Therapies is going to share what exciting news they're bringing here to Nevada, and I will let them take it from here.
Awesome, thank you. I do have some slides to share. Oh, perfect. You've got it pulled up for me. Okay, well, thanks so much for the opportunity to be here today. I have thoroughly enjoyed listening to all of the presenters, all of the patient and family stories, and I'm really excited to share with you a little bit about Optum Frontier Therapies, which is a new specialty pharmacy model that's coming to help serve rare patients, rare disease patients, just like we've been talking about today. Next slide, please. I won't belabor about myself. I am a pharmacist, and I'm so excited to be a part of Optum Frontier Therapies, where where my colleagues share the same passion about patients and families and really connecting. The compassion is so important on this team. So go ahead and move to the next slide, please. So Optum Frontier Therapies is a specialty pharmacy that was conceived really for the need of a different level of service and care. So thinking back on several of the stories that we've heard today, right? There's just these rare and ultra rare diseases and other new therapies that are coming to the market. And sometimes they're complex, and the care needed to support them is also complex. And, you know, as was mentioned throughout today, there's only a handful of patients oftentimes across the entire nation. And this really means it's a maze for the families to navigate their disease journey, but it's also a challenge for the provider. So many of these rare diseases, like we heard about today, there's never been a treatment option. So while the providers might be a little familiar with the disease, they're not familiar with the new medications that are coming to the market. So the prior authorization process might be a mystery. And so Optum Frontier Therapies is really here to streamline the patient access, support the families, and also support the providers. Next slide, please. So I'm really excited that our flagship location is right in Las Vegas, Nevada. In fact, the team is there now. They're busy building out a team of experts. And as I mentioned before, we're really focused on hiring the right people to become part of the team. So compassion and the desire to do the right thing for patients is paramount. And this location will be opening this May. And hopefully we'll be taking care of some of you or your family members or neighbors. And we have strong connections and ties to the community and local providers, but we also have a national footprint, and we'll be taking care of rare disease patients across the country. We also have a location in Flint, Michigan, which is currently in operation, and this will offer another location to service our patients out of. So there should be a natural disaster or something like that. We'll have two locations with the same services and capabilities to ensure that our patients never miss their medications or needed supplies. Next slide, please. So I know we're short on time, and I really wanted to spend a little bit on this slide to tell you what's unique and what's different about Optum Frontier Therapies and about our service model. But I'll try and hit on some of the highlights, and it's really this care ambassador. So when you think about all the other confusion that these patients and their families are going through to get the care, to get access, to find a provider, you know, we want to make this easy, and we're really trying to lift the burden for the patient as well as the provider. So we have this single point of contact called the care ambassador. So we're talking about a direct phone number. So when you have a question or a concern, you've got a number to call, and you're reaching the same person, the person that you've gotten to know since the very beginning of your care. And that clinical pharmacist also has a direct phone line. So again, the ability to connect with really part of your medical team, and that's what makes our specialty pharmacy a little bit different in the model. We know that these patients and the families are already traversing a very complex journey, so we're trying to make it as easy as possible along every step of the way. Next slide, please. So Optum Frontier Therapies really will offer many modes of communication, but it all starts with a phone call. And this is the opportunity to get to know the patient and the family, and also learn preferences, right? So do they prefer phone calls on Wednesday nights or text messages as refill reminders? We recognize every family has different needs and wants, and so we're really committed to meeting the patient and family where they need to be met. And this includes our virtual visits. So this is an opportunity to meet your pharmacist face-to-face and be counseled. So when you think about learning to inject a medication for the first time, you can record this session and watch it later. You can share it with a family member or a caregiver. And so it's just another way to ensure patients know how to take the medication properly. And so these virtual visits can be scheduled or on demand. So again, just making it as easy and convenient for the family and the patient. So these additional services really don't matter if the patient can't get on the therapy, and that's why we take the time and hire the right people and provide ongoing education. So they know about the medication, they know about the disease, and they know how to get a prior authorization approved, and they really work to lift the financial burden that is often associated with these complex therapeutics. So the patient can afford to get on therapy and also to stay on therapy. And we have ancillary providers to help support the patient as needed, such as a dietitian, geneticist, and more. So we're really solving the right problem along the way. So whether you live in Las Vegas, Boston, Omaha, Optum Frontier Therapies is really focused on building these relationships by connecting patients to patient communities and advocacy groups, so they have ability to connect with others going through a similar journey. So just like we're here partnering with NORD today, we will continue to stay connected and educated through forums like this one and through patients and providers and lawmakers that shared their stories today. Next slide. So I can't thank you enough for giving me the opportunity to be here. And we're so excited to offer a new specialty pharmacy model to take care of rare disease patients and support providers committed to taking care of them. Our goal is to collaborate and synergize to make these complex journeys easier for everyone traversing them. If what I shared today resonates with you, please
We lost you.
Oh, I think we lost sound for Shelley, but thank you, Shelley.
Yes, thank you, Shelley, so much for taking the time. We really appreciate it. Knowing, because I have sub-Q infusions and the struggles getting the medications, I think Optum Frontier is going to be a huge game changer here in Nevada. So if you have questions, please feel free to drop them in the chat box as well. With that, we are at the end of our presentations. We got everybody in, we got everybody speaking. We've heard, for me, I've heard so much information, and we do have a door prize, and we will be choosing the winner at the end. We'll take everybody's name and put them in a raffle. And
Amy, we're gonna draw the door prize after. So keep an eye on your inboxes. If you get an email today or tomorrow that you've won, congratulations, this is what you won.
Sorry, it changed at one point, and so sorry about that. But with that being said, we've heard from so many wonderful people, patients, caregivers, senators, everyone. And as a community, we are strong, and getting our word, sharing our story more often is what's going to make the change here in Nevada. What I've heard across the board is healthcare needs to change, and we need to bring it back here in our state and not be having to travel. Most of us have been fortunate to be able to travel to other states to get the care we need, but that's not truly a possibility. And that's what advocating is about. And well, you're not alone. In the beginning, I felt awkward sharing my story. I still feel awkward sharing my story, and I still don't always like hearing my own voice. But it's thanks to people like you and giving me the support and the motivation is what keeps me going every day. So in that, Kristen, did you have anything else that you'd like to share with NORD, or anything that maybe I missed, or is there any questions?
I just want to thank you, Amy, for all the work you put in today, and thank you to all the speakers for joining us. We have a very brief video to close out the day, and Sunday is officially Rare Disease Day, so tune in online. We've got the official hashtag is #RareDiseaseDay, and follow along, show your stripes, and share your stories. Thank you for joining us today, and we'll close out with this brief thank you video, and we'll be good to go. Have a great day.
Every year on the last day of February, the National Organization for Rare Disorders joins together with others around the world to raise awareness of the challenges faced by people living with rare diseases. Achieving health equity is even more difficult for rare patients. To have equity in health means everyone has an opportunity to be as healthy as possible, regardless of social, geographic, economic, or other obstacles that may be working against them. At NORD, we appreciate your support, which allows us to work on issues like health equity and many others, and for our staff and volunteers to bring them to the forefront on Rare Disease Day.
From the Volunteer State Ambassadors, we would like to say thank you to all of our Rare Action Network supporters for helping us connect with rare patients and families in our state.
And thank you
for allowing the Rare Action Network to raise important issues with state lawmakers on Rare Disease Day and throughout the year.
Did you know that in medical school I was told when you hear hoofbeats, think horses, not zebras? Well, what about the more than 25 million Americans living with a rare disease? At NORD, we are humbled to provide help and resources to our zebras and their caregivers.
NORD support allowed me to catch up on some overdue bills, including my rent. Thank you for your support, NORD, and thank you for supporting Rare Disease Day.
From all of us at NORD, thank you for your dedication to the rare disease community on Rare Disease Day and every day.
So we do have 5 minutes till the time is up. If anybody has any questions for anyone or any would like to share, we do have just a couple minutes if anybody would like to ask any questions, or we can say goodbye. And thank you all for joining again today.
Yes, thank you guys for taking the time out of your busy days and listening to everybody and pulling together. But yes, if anybody would like, this is open to anyone at this point. So if you didn't have time to finish what you wanted to say, or if you'd like to add anything, please feel free to unmute yourself and
I'll go first. This is Shelley Nickerson. I'm so sorry. I think my audio dropped out and I don't know when that happened. So
like the very
very perfect. Just the last thing I wanted to add was if you want to go to frontiertherapies.optum.com and you put in your email address, and it gives you the opportunity to stay up to date on what's new and what's happening and coming for the future with Optum Frontier Therapies. So thank you again, everyone, for allowing me to be a part of this today. It was
Thank you. Awesome. Well, I'll give one more shout out to Amy, and I'll also suggest those of you on the call that are interested in getting more involved with the Nevada Rare Action Network and the work that we're doing here at NORD, to please either connect with myself or Amy. We are definitely looking for some volunteer leaders to help out in Nevada, and we would welcome your participation.
yes, and thanks for those who have already private messaged me in regards to that, and Kristen and I will get together. And thank you, Kristen. I know you've been doing this. You got one more in your books today, 5.
We're more than halfway there today. We're good. All right. Bye, all. Thank you.
Thank
Bye.
you.
Thank you.
Bye-bye.
Thank you. Bye.
Thank you.